Now, welcome back to Newslink. Now, stage 2 power cuts will continue until 5 a.m. on Wednesday this week. This after rolling blackouts were suspended on Friday. Eskom says the loss of 4 additional power generation units this weekend and the delay in some units returning to service has resulted in the implementation of the power cuts. It's warning that any further deterioration in generation capacity could lead to higher stages of blackouts. Now, debate is raging over whether children under 12 should receive a COVID-19 vaccination. There are no immediate plans to vaccinate children under 5 to 11 in the country, but some health experts say the age group should receive the jab before the expected 5th wave in winter. Pediatrician Dr. Iqbal Karbanee speaks to us now. Dr. Iqbal, thank you very much for your time this morning. Now, inasmuch as data has proven that the elderly and those with comorbidities are the most vulnerable, the debate around the vaccinating of this cohort has resurfaced again. Should parents be seriously monitoring this debate with talks of now an imminent 5th wave?
Thanks, Mfundo. Yes, there's no doubt that vaccination is going to be a key tool in our toolbox to fight this COVID epidemic. We know that children tend to have milder disease, but they also tend to be carriers. So if we're looking at reducing the amount of infection in the community and increase herd immunity, there's no doubt that that cohort of 5 to 12 is one of the most important cohorts as a reservoir of infection. So vaccination is no doubt an important step forward in the fight against COVID. And I think that as parents are rightly concerned, is there a problem with safety? And I think those questions are ones that are very important that need to be answered.
But then now we have other experts that believe that this group or cohort remains at the lowest risk insofar as severe illness is concerned. And then there's been debates that do the risk outweigh the benefit? So what does a parent honestly do in this respect? I know with the UK and France, they've opted to actually offer the vaccine to this cohort. But some in South Africa say because it's not in our plans, it means it's not really beneficial.
Okay, I think that there's 2 issues here. The first one, is the vaccine safe? And the second one is that, is it necessary in this cohort? So let's go to the second question first, and that, is it necessary in this cohort? And the answer to that is yes, it is. Because, as I said, they tend to, as you correctly said, they tend to have milder disease, but they also end up being reservoirs of infection, or they spread infection. Often they've been, especially in the South African setting, young children are looked after by elderly grandparents or older caregivers, etc., and they will be taking that infection home. As we return to some kind of normality in society, with children getting back to school and preschools, with reduced social distancing in schools, the chances of infection spreading in the school environment remains very high, and therefore this group should be vaccinated. As far as the actual safety of the vaccine goes, there's no doubt that this is a safe vaccine. And the reason why I say that is because, just for the general public out there, there's 2 main types of vaccines. There's a live virus vaccine. Here you can think of the measles vaccine. And then there's something called an mRNA virus vaccine, which is basically a bit of the protein of the virus that is given to the body, that teaches the body to fight against the virus that it comes from. And the vaccine that has been approved in this cohort is the latter. It's the mRNA vaccine. So it's a very safe vaccine. And people often ask me, but how was it established so fast that it's safe? The reason it's established so quickly is that we use the experience in developing other mRNA vaccines to get to this point much faster than previously in history.
No, I suppose that settles it. It's quite comforting for most parents. But then on the 5th wave itself, firstly, I acknowledge the difficulty in making definitive predictions around new waves. But if we were to look at the trend, the waves have been characterized by an increase in transmissibility and decrease in severity. Do we expect the 5th wave to somewhat follow in that trend?
Well, we all hope and expect that it does. But one thing this virus has shown us is that it's unpredictable. So while we hope that the 5th wave will be a decreased sort of infectivity or decreased rate of complications with a higher transmissibility as is expected from the past, we don't know. And unfortunately, until we're actually in the 5th wave and the subtypes have been, genotyped, etc., we won't actually know what's happening. So I think, what this epidemic has shown us is that we should prepare for the worst but hope for the best. And I think vaccinating the children should definitely be something that we do just to make sure that we protect the vulnerable members. Remember that when you vaccinate your child, you're doing it for 2 reasons. You're doing it to protect your own child, but you're also doing it to protect the community at large. And I think this is where it becomes a social responsibility to actually vaccinate, so that that immunity that develops in that child is part of the greater good. And that is what's important here. So as a society, we can return to some kind of new normal as soon as possible.
Dr. Karbanee, thank you very much for your insights. That was pediatrician Dr. Iqbal Karbanee. To this